A new study shows physical abuse of school-age children has tripled during the pandemic. And that means at least 1 in 7 children have experienced child abuse or neglect in the past year in the U.S. Oftentimes, there are warning signs. We want to help you spot them as we mark Child Abuse Prevention Month. Dr. Kathleen Dully with the first child prevention team with UF Health has joining us now via Zoom. Good morning. Thank you so much for joining us.
Thank you for having me.
Can you tell us what are some warning signs that people should look out for if younger children and older children, if there's any signs of abuse? What are those signs?
If you're seeing injuries that don't make sense to you, if they're unexplained or the story that you're given doesn't add up, if the child looks thin, every time you visit them, they're hungry and they eat like crazy, that makes you wonder if they're getting good care when you're not around. And sometimes it's crossing the line into abuse.
And what would you say are the most common injuries?
The easy things are handprint bruises. And things from implements like belts, switches, wooden spoons, hairbrushes. So anything that gives the outline of an object makes you know it's not a random event. You didn't dink into the corner of something. If you can identify the implement that left a straight injury or an angled injury on the skin. And handprints look like handprints. I know you would have to turn the lights on. And you would actually have to look. You might see something on the face, but not necessarily. So bath time and swimming time and pajama time, toothbrush time, when kids are changing their clothes, is a chance for you to peek and see how things are going when you're not around, and to be a little bit not obvious about it so that kids don't feel like they're being stared at.
And obviously, a lot of parents and kids are spending a lot more time together in the home with the pandemic. Not as many families, over the past couple of years have been getting out as much, causing tensions at home and leading to an increase in child abuse. What can families do to prevent this kind of thing from happening and make sure children are safe?
Well, we, the adults, need to be doing self-care on steroids. We need to be getting enough rest. We need to be trying to find ways to decrease our scheduling and our stress and be more available and connected to the kids. Kids can tell when you're too busy to listen, and then they don't tell you anything. So it's important to try to slow down. It turns out during the pandemic, we may have done a better job with the babies than the older children. The babies did not have an increase based on this latest study and a couple of others in fractures or in head trauma during the pandemic, which surprises us all because we were also worried child abuse was going to increase. But for older children and children over 5 who are not in school and not in daycare, they were getting put into ad hoc childcare situations, sometimes last-minute arrangements. This was necessary, but they were getting hurt more and they were getting mistreated more. So older children had more fractures, more serious trauma. More of them died in the emergency department, did not even make it upstairs into the hospital. And they also had more accidents, which I think is something we parents, grandparents, and childminders really can help with. We saw more children injured by weapons in a home not their own. More children in motor vehicle accidents who were maybe in a booster seat, but the shoulder harness was behind them, not across the chest. More children on ATVs, like on the handlebars with a teenager driving. More golf cart accidents and more dog bites because more families got dogs and we're not all dog people or didn't grow up with dogs ourselves.
This is all heartbreaking to hear, and I'm sorry to cut you off, but before we go, I want to make sure we know what resources are available for families who need help, and especially if you see a child who might be suffering, how can you make sure they get help?
Spend more time. Now that children are back in school, the schools also have resources that may not require extra driving or extra time and stress for the caregivers. Talk to the child's pediatrician Bring them to the ER. If you really think you're seeing something quite worrisome, we want to help get to the bottom of things. We want to ask DCF to help us. Don't be afraid of them. They just want us to accept help and accept change and not raise our children the way we were raised. Neglect is not so benign, especially during the pandemic. I would keep in mind that we all as grown-ups need to behave as best as possible and help each other behave. So if you see someone who needs help, jump in and help them. If their kids are out on bikes with no helmets, bring the helmets out of your garage that your kid used to use.
This is all such wonderful information. I'm so sorry we're running out of time, Dr. Kathleen Dully, but thank you so much for joining us this morning. We truly appreciate your time. And if you are anyone that you know someone that might be being abused, call the National Domestic Violence Hotline at 1-800-799-7233.